Okay, we're going to show you guys how to take an alginate impression, so that way when you come to lab you'll be prepared and know what's going on. So our first thing is make sure you have all the right equipment. So when you come into lab, you'll have a kit that is full with all of the things you need. So a spatula, a lab knife, you'll have 2 mixing bowls, your alginate scoop, your water, measuring cup, and your alginate. So after you have all your right supplies, you want to designate your working area with a bib, so that way it can stay clean and it will absorb any of the saliva or water and not get onto the countertop. And then you'll decide what kind of tray will fit your patient's mouth. We'll help you in lab to fit it properly, but we'll go from there. So we're gonna get some gloves on, and I'll try these trays in to make sure they fit her mouth properly. Just like in the Gordon Christensen video, you'll want to make sure that it fits without bumping up against her molars in the back, but that her lips can still go over the front of the tray. Just gonna try this in here. And it goes up and over, her lips can come over, and then if I reach my finger in the back, it covers her molars in the back. So that fits her mouth just right. But if you go in and her lips don't cover the tray all the way, then you'll need to get a smaller size. If you go with a smaller size and it bumps her molars or gums in the back with the tray, then we can soften the tray and flare it out so it fits the molars better. Also, if it's a little bit short on the molars, we can add wax to the back of the tray so it will fit her mouth properly. Okay, once you have the trays fitting just the right way, I'm just going to double check the mandibular one. And that looks great. It covers her molars, her lips covered just right. You can lift up your tongue, and that looks great. So that's just what we're looking for. It's great. Okay, so now we have the right size trays. I'm going to remove my gloves. We're going to measure out our alginate. So with your tub of alginate, you're going to fluff the powder after it's been sitting. And then when you open up the lid, make sure you open it up away from you so that the powder floats away from you. Otherwise, you get all this powder that will come into your face. And then you're going to use your alginate scoop. And typically you'll use about 2 scoops for small and medium trays, and large trays you'll use 3 scoops. So if you look at this, you can see how there's little gaps, air bubbles in the alginate powder. So I'm just gonna hold it over my tub and tap it once or twice, just slightly. You don't wanna like pack it in there, but just a little bit, and then scrape off the top layer so it's an even scoop. And then you'll tap it into your bowl. And we're gonna do 2 of those. So tap, tap, and scrape it across, and then tap it into your bowl. And you can set that to the side. And then I already measured out my water. It's room temperature, and I measured, you can see on the measuring cup, we do 2 scoops, so we do 2 scoops of 2 lines of water. And then, now that I have everything measured out, I am ready to go ahead and take the impression. So I'm gonna put on my PPE. Mask and glasses because we'll be working intraoral. I'll put on some gloves. Okay, now when we're taking alginate impressions, typically you're in an office and not in this type of a chair. They're in an operatory chair. So you want to make sure that you're not standing straight in front of your patient. Otherwise, if they were really in a chair, you would be straddling them, and obviously that wouldn't be okay. So you want to stand to the side of them or behind them when you're taking the impression. So be aware of that. And I'm going to stand behind her. So I'm going to scoot this stuff down. Okay, we're gonna go ahead and start mixing now that we already have our alginate measured out, which is different than the Gordon video because they had the water in here first and then the powder, but we don't want you to have your gloves on to get into the alginate tub. So no gloves, measure out your alginate, and then get your water. Get your gloves on, and then we'll pour in our water. Remember, as soon as you put the water in the alginate, it's starting to set, so you need to be quick. So we're going to go ahead and pour this in here and start mixing. And incorporate all the powder first, and then start smushing it up against the edges of your bowl. And get all the dry powder off the edges of the bowl and the back of the spatula. So it's a nice, creamy, smooth mix, no lumps or dry material. So that's a good mixture there. And grab half of your alginate with your tray, and you're gonna point the tray away from you and scrape that alginate along that edge of that tray. And grab some more alginate. Now you're gonna point the tray towards you and scrape on the other half of the alginate. And then we're gonna do one more scoop and put it on the front. I like to have enough alginate that it's higher than the edge of the tray. And then we're gonna use our finger to get some alginate and put it on the occlusal surfaces of her molars to prevent getting air bubbles on the occlusal surfaces. And then one more thing of alginate on the anterior vestibule. And this we found over time helps so you don't get air bubbles in the vestibule up front. Now inserting the tray, you want to pull her cheek out and then use the tray to push it out on the other side. And then you're going to pull her lip up and out and over that tray. Then I'm going to have my patient push her head down into the tray, and you'll see all that alginate squishing out of those holes. That's what we want to see. You know, make sure that that lip is really over the front of that tray and you got nice amount of alginate underneath that lip up front. And then you're going to keep that pressure on the tray the entire time. You don't want to let go, otherwise you won't have a nice impression of those molars in the back. So we usually plan on a good 2 minutes, and we use really cold water so we had enough time to work with it and load it in our tray. As you become more proficient at taking impressions, then you can start using more room temperature water to make it go a little quicker. But because of the video, we used the cold water so that we had more working time. And as it's setting, you're gonna check it periodically and make sure that or check to see if it's done. I kind of just push it with my fingernail. If I can't see my fingernail indent into the alginate, then it's probably set up. But I always like to go just a little bit longer just to be really sure that it's completely set up. Okay, I'm gonna quickly grab a paper towel for my patient. There's this for you. And then removing the impression tray from her mouth, you're going to use the handle and you kind of do like a rocking motion. If it's still not coming out, then you can put your finger up above the vestibule and break that seal. Oh. And a good seal like this is what we're looking for. Okay, so we're gonna take a look at this alginate impression. It's pretty good, especially if we're gonna do a bleach tray. That's what we're looking for. So you can let your patient go up and rinse out and clean off, and then I'm gonna rinse the alginate impression in the water.